In Health Watch, have you ever felt, answer's pretty obvious for most people, burned out at work? Well, it turns out the World Health Organization will now officially recognize that as a legitimate medical condition. The agency, which guides many health providers, will now include burnout in its International Classification of Diseases handbook. Symptoms, they say, include feelings of exhaustion, workplace cynicism, and difficulty doing a job successfully. Joining us now from Fort Lauderdale, Florida, is Dr. Daniel Bober. Dr. Bober is a psychiatrist and a certified addiction medicine physician. Welcome, doctor. Thank you.
Thank you, Chip. Glad to be here.
As an average worker, how do you know if you're feeling burned out?
Well, I don't think there's an objective test necessarily, but I think I've seen it myself in the medical profession. You know, people that just don't want to be at their job anymore, they become depressed, they, can't sleep, they're gaining weight, and they're just sort of over it. And when you're talking about burnout, what you're really talking about is chronic stress. And chronic stress is a killer. It increases the risk of heart disease, of high blood pressure, of stroke, of cancer. It wreaks havoc on your body, and it can shorten your life expectancy.
Well, now that it's officially a condition, what do you recommend? What can people do to fight this?
Well, from the side of corporate America, there was an interesting study in New Zealand that looked at this issue, and what they found was that the 4-day work week actually increased productivity 20%. All right. Another thing is flexible hours. So when you give people flexible hours, their productivity increases as dramatically. And so what we need to look at is the side of corporate America, what they can do, and what we can do as workers is de-stress, unplug. We're talking about good diet, good sleep, yoga, exercise, things to decompress and get yourself, in a good state of mind.
What do you think led to this decision at long last by the World Health Organization to acknowledge burnout as a syndrome officially?
I applaud the World Health Organization for their efforts. I think it's important to recognize this because I think we all feel overworked. And I also think in the Western culture, particularly, people are rewarded for longer hours, and you talk about working smarter and not harder. And I think we need to recognize the fact that our jobs are essentially killing us, and that it really contributes to the burden of disease when we're all burned out and we feel stressed.
Doctor, we've all felt these symptoms at one time or another, but how does one differentiate between a legitimate burnout and just a brief episode of frustration at work?
Well, there's a gender differential reaction. Men tend to be more cynical, whereas women tend to be more emotionally exhausted. So I would say that if it's getting to the point where you don't even want to go to your job anymore, where it's affecting your daily functioning in terms of gaining weight or not being able to sleep or feeling depressed, then it's something that's really affecting your health. And you may even want to think about getting another job altogether.
Well, that's an extreme step, but today we live and work in a 24-hour cycle, whether it's text or email. Work can become intrusive in our daily lives. Do you believe this has played a role in more people feeling burned out?
I do. I think as a society, we're totally overstimulated. As you said, we never have a break. Our phones are constantly going off. There's a 24-hour news cycle. Social media itself feels like another job. So I feel like our minds just don't have time to rest. And I think it goes back to what I said in the beginning, which is it's just a chronic stress condition.
Well, doctor, this is fascinating, and I'd love to ask more questions, but I'm burned out. So, Dr. Daniel Bober, thank you very much.
Thanks, Chip.
Right.